Superintendent, you good?
Yes, at this time, our second works. Well, first of all, thank you to the entire team for that in-depth mid-year instructional review, and thank you to the board for your comments and feedback. The second presentation will be school behavioral and mental health. Obviously, this is a part of, in response to Marjory Stoneman Douglas Act and just other great work we've been doing in the district, but part of why this entire team needs to come forward is that this work is still in evolution. And so our board has been having robust conversations about this for months. And I'm excited for the team to present where we are today and our plans moving forward. Keith?
Thank you, Dr. Fenoy. And there is a lot of exciting work that's happening with school behavioral mental health. And I do want to connect this back to our last workshop around our strategic plan. There's a specific initiative that calls out expanding and supporting mental behavioral health. The board did ask for a workshop to what are we doing in this particular space. With me today, we have Junisa, Director of Safe Schools, who has spent a lot of her time not only in SEL, but really this work that was put upon the district this past summer with the Stoneman Douglas Act. A lot of work has happened very quickly that we're going to get into. Also to my right, we have Dr. Michael Kane and Dr. Shannon, who are with the Safe Schools Department managers who've been leading a lot of this work. I'm sorry, in the middle there, I'm sorry, Shannon's on the end. And Major Griffin, Major Griffin's going to talk about some exciting work that we're doing with School Police Department, working on this work as well. Traditionally, and there's Mr. McCormick. Mr. McCormick also, who's been a big part of this work as well. And Mr. McCormick actually led a lot of the work this summer with Bertha 22 subgroup to help inform some of the decisions that we move forward. All of the work that we're talking about today is about a continuum of services that we provide our students. And those supports range from those students who need a lot of preventive work that touches, we talked about earlier, who do we check in with at the beginning of the day, to those kids who have some serious concerns that we're providing intensive support. And the workshop really framed around how we provide that continuum of supports. Historically, when we talk about mental behavior health, not necessarily the primary business of what we do, but we always have provided that support for our kids through our behavioral health agreements. We do have, obviously, traditionally our school counselors, our school psychologists, family counselors. We have behavior resource teachers that exist throughout our district. This has been traditionally about how we actually service and provide support to our kids. Also through our processes that we have in place, our systems from our school-based teams, we develop functional behavior assessments. And for those kids who need more intensive support, we have our Schools Indian Ridge to provide that therapeutic setting and our EBD settings. So moving forward, a lot changed though, obviously this past summer, and I'm going to turn over to the team to talk about what's changed.
Okay, so we know that 1 in 5 students or young people ages 13 to 18 have or will have a serious mental illness, and about half of all the lifetime cases of mental illness begin by age 14, and that access for mental health supports can be a challenge for families. We also know that when students have a delay in receiving support or do not receive support, that it can increase the risk of dropping out, academic struggles, becoming truant, or exhibiting behavioral difficulties. And we know that schools, when mental health supports are provided at the school site, there's an increased likelihood that young people will be able to access those supports. The mental health allocation requires us to focus on the provision of mental health assessment, diagnosis, intervention, treatment, and recovery services to students with mental health or co-occurring substance abuse diagnoses and students at risk of such diagnoses, and that these services must expand student access to mental health supports and may not supplant the existing work of district mental health professionals such as our school counselors, school psychologists, or family counselors, or supplant the supports provided to students through our collaborative mental health partners that have behavioral health agreements. Within our mental health allocation plan, our district received a one-time allocation of $3.8 million, of which 90% of that needed to be dedicated to direct mental health services for students. And the mental health allocation plan was developed through the collaborative efforts of multiple district departments and community agency partners. And based on that plan, we focused our efforts into three main areas: the establishment of crisis assessment, prevention, education, and support teams. We call them C.A.P.E teams. The establishment of co-located mental health professionals being assigned on our school campus, and the infrastructure, or essentially the staff to support that work. The school district of Palm Beach County has qualified mental health professionals on staff and in place. Our district-employed mental health professionals include school counselors, school psychologists, and family counselors. In addition, we have collaborative behavioral health agreements, and these collaborative agreements have professionals in place that work with our students to provide mental health supports. And then, as provided for in the mental health allocation plan, we have contracted agencies that have placed co-located mental health professionals on school campuses at identified school sites. With those co-located mental health professionals, we have them in place providing individual counseling supports to students with intense unmet mental health needs. This work supplements the existing work of our district professionals and is conducting in collaboration with our school teams. The co-located mental health professionals source from 7 agencies with behavioral health agreements, and they are credentialed professionals and agency supervised. The table reflected here shows some of the work they've engaged in since they've come online, which is roughly October, November, in terms of the number of students who have been referred for services, the number of students who we've obtained consent for individual counseling supports, and the number of open cases as defined by the number of students that have ongoing counseling services, have completed counseling services, or in the wait list to receive counseling services. I do have updated numbers, which were tallies that I completed yesterday, and that we have, as of yesterday, 1,860 students who have been referred for services through this program. We have 1,274 students that have the parents have provided consent for services, and 1,274 students that are receiving or have received counseling services through the co-located mental health professional initiative.
I think this is really important to note that this is within 60 schools that we are touching. So our goal is to expand this with the referendum dollars, but this is just within 60 schools to show that there is a need that exists in our schools.
I mentioned our C.A.P.E teams a few moments ago. Our C.A.P.E teams support schools through mobile response to schools by mental health professionals to support students who are experiencing a mental health or a behavioral health crisis or challenge. The C.A.P.E teams, upon arrival on a school campus, will engage in observation, assessment, intervention, and planning services with that school site, and those services are done in collaboration with the school teams, students, and their families. Also, our C.A.P.E teams actively collaborate with other district departments, or essentially any body, any agency that has engagement with that student. Our C.A.P.E teams will engage with them for collaborative planning. The chart here reflects the number of cases that we've engaged with so far this year with the advent of our C.A.P.E teams. I do have updated numbers as of yesterday, which reflects that as of yesterday, we've worked with 267 cases, or 267 students to receive C.A.P.E team support. I'll also mention that our mobile response teams that are in place through Jerome Golden and South County Mental Health remain and are actively supporting our schools on a daily basis.
So Behavioral Services Unit in the School Police Department is something that's brand new this year. I believe the last time I had the opportunity to present before you was right around the same time last year when we were talking about youth court. And of course, we know what happened on that day. That was February 14th. So here we are a year later, and are still working feverishly in the youth court side, but we're also working on the Behavioral Services Unit side as well in school police. This division, or this unit, is dedicated exclusively to prevention and intervention of criminal activity related to those kids, that small percentage of kids that present with homicidal, suicidal, extreme suicidal, or predatory ideation. And it's the division, the unit is comprised exclusively of police officers who have advanced education in social work, mental health counseling, crisis intervention, and they monitor basically they look at the cases from a forensic perspective. So we're looking at not only the criminal case, but we're looking at the behavioral considerations and how that can complicate the criminal case, and what services that we can put in place for those particular students. So some of the things that we provide, the investigators provide, is the oversight of our current district cases. We have the means of monitoring those particular cases through our report writing system, so that we can kind of keep a close eye on those kids and their particular needs. Referrals to district services, inside and outside. And this is the perfect team of collaboration here. We meet weekly, we communicate constantly on these cases. We also conduct home visits, and we do that in cooperation with Palm Beach County Sheriff's Office and as well as the municipalities. So just so that we can kind of make sure that our children are safe. We also collaborate as it relates to risk protection orders. So of those cases where we have students that have access to weapons, we want to make sure that we eliminate that risk, and so we work with the Sheriff's Office on those efforts as well. We do, on some cases, custodial encounters where we have to do Baker Acts or arrests, sometimes both. That's not what we want to do. We don't want to necessarily have to do that, but in the interest of safety for all, that is something that we do on our team. We also do monitoring, and this is the biggest piece of the entire puzzle, is that even when a child has predatory ideation or homicidal ideation, sometimes it doesn't criminally meet the elements of the crime. So monitoring is the biggest piece, and that has a lot to do with collaboration with all of our officers are assigned at every single school. So when a student surfaces that we recognize that could be a potential risk, we make sure that we're staying connected, closely connected to the officers and the staff at every single school to pay attention to the behaviors. We also do social media oversight. So that's some really great, exciting work. With our new administration, there's a lot of technology pieces that are coming forward, and so that gives us the opportunity to pay closer attention when keywords surface that are captured into geofencing. We also do anonymous reporting oversight. So of the places where we receive these threats, we receive them at the school level, from the officers, from the administrators, from parents. We receive them from people in the community, Crime Stoppers, Student Protect app, Fortify Florida, all of those places. They come in from a lot of different places. So we monitor that very closely as well. As it relates to collaboration, this is definitely a all eyes and all hands are on deck. And we look at this from a perspective of shared citizens. These are our kids during the day, but they belong to the community in the afternoon and on the weekends. So we're constantly communicating about our shared cases and our shared citizens that we have concern about. We also offer assistance to our police officers in the schools on mental health related cases. So if it rises to the level where the officer just isn't sure, we enlist the support of our C.A.P.E teams. Certainly we have a vast amount of professionals that can help us to come to those conclusions, to include mobile crisis. So we do that as well. Interestingly enough, and I presented to you guys last year, so Youth Court has the juvenile first offender kids. We have our youth diversion program 1, 2, 3 kids that we talked about last year. We've now added youth diversion program 4. So that is exclusively for our kids that are charged with written threats to kill. And so there's additional monitoring that goes into those cases as well. The beauty of this newly defined unit is that we are constantly collaborating with our youth court folks, so they're all under the same team. So they're constantly communicating about the kids that are charged and are being held accountable through the youth court process, but also need to be monitored by our behavioral services detectives. So they're constantly communicating, which is great. And again, we have continued collaboration not only within the district, but also outside the district through the Department of Juvenile Justice, JFK North, our behavioral supports, ESC, Safe Schools, school-based teams, threat assessment teams, we're doing a lot of talking and sharing of information. And I touched on this earlier, but our detectives are specialized. We only, I'm only handpicking the very, very best, the most specially qualified for this particular assignment, because we have to look at it from, I always call it from having two brains or having two lenses. So I want them to be able to view it from the mental health lens, but also from the criminal investigator lens. So, sometimes one bleeds into the next and so forth. So having the opportunity to see it from both lenses is extraordinarily helpful in this particular assignment. So the detectives that are assigned with me either have master's level degrees in social work, mental health counseling, advanced training in trauma, advanced training in CIT, or extensive investigative experience with these types of cases.
So in the springtime, the Department of Safe Schools created a pilot that would look to address some of our most intensive behavioral health concerns at some of our highest needed schools. So we created 2 pockets and hired 2 pockets of people. Our behavioral health resource teachers, there were 3 of them that were hired, and they service 6 schools, so they each have 2 schools apiece. Some of the things that they work to do on those campuses is that they support SBT meetings, they meet with students and mentor them. They collaborate with agencies that have a behavioral health cooperative agreement. So working with those families and being able to link them together to services outside of the school campus. And they are also trained in youth mental health first aid, which I'll speak about in a little bit. And our second pot that we created, hired, were the social service facilitators. There are 4 of them. They are housed at 8 campuses, including 2 alternative ed sites. These social service facilitators support students that are experiencing a mental health crisis. They also assist with reentry planning. So students who are returning to our campuses from a hospitalization, they are working with the staffs in order to create a plan to work with those students. They also attend school-based team meetings, and they too work to collaborate with agencies and working with families to help them receive outside services or services to push in for those agencies with the behavioral health cooperative agreement. What you'll see on this chart is by month the student contact for this team. This team, again, is comprised of 7 individuals. They are working with 14 campuses. So in addition to the numbers that Dr. Kane provided, these are additional student contacts that our students are now reaching out and receiving services. You'll see that we have increased as we went on through each month, and as of February 25th, our numbers were 109. So that was as of February 25th. So again, as our students are being able to reach out to adults on our campuses to have some type of service or referral, we're seeing those numbers increase by this team as well. For professional development, the Department of Safe Schools has been training in youth mental health first aid for the last 3.5 years, so we're very happy to see that that was one of the initiatives through the Senate bill that we were already training with that. You'll see that we have 40 youth mental health first aid instructors. These classes, or this class in particular, is working for youth between the ages of 12 to 18, so it's working to experience and being able to recognize those signs and symptoms of students who may be experiencing a mental health challenge or crisis. As of February 12th, we have provided 148 classes. There are over 2,000 first aid trainers that have been trained. We have multiple classes that are on ELM, and so we invite any staff member who has not been trained in youth mental health first aid to please register and attend one of those great classes.
And what you've heard so far is the implementation of the mental health allocation plan that you all approved. But inclusive of Senate Bill 7026 was also some requirements. We were able to design our plan, and you've heard the implementation, and we're moving forward with that with the referendum dollars, which I'm going to touch on as well. But I wanted to touch on a couple of requirements that we had, and one of them was the change to our registration form. We needed to add language onto our registration form, and we did that. In the new and returning student registration form, there is now a question that says, has the student ever been referred for mental health services? So the parent or guardian, upon registering their child, has to answer that question. There are 3 options for that question. It's yes, no, or not known. That information is then entered into our SIS system. We did create a mental health tab within our SIS system. It is very carefully monitored on who is able to have access to it. They need to go through a number of steps before they're given access, inclusive of the school center plus district staff being able to give access so they can see that tab. It's very important to note that when a parent or guardian comes in and writes down that yes, the child has had a mental health service referral, that staff from our school centers then meets with that parent or guardian on an individual basis so that we can gather some more information. What did that mental health referral? How can we assist you? Is there services that you need? So there's always a follow-up. We have had parents where have written it yes, and what it has turned out to be is that they have, something that they had a grief, a parent pass away or something like that, and we tried to talk them through what we're looking for in the mental health referral. They get the option as to whether they want to leave the referral there or not. And I'm just giving one example where we talk about it. Then there'll be the mental health referrals where we get deeper into it and we give services to those students from what you've seen. The other part of it is also the DOE reporting. We are responsible for the accountability of everything that you just heard mentioned inside of our implementation plan, and we are going to be responsible for submitting a plan on September 30th. A lot of the work that we have done this year has been around the accountability piece inside of the implementation piece, but those are some of the pieces that we're going to have to respond to. What is the number of students who have received mental health screenings or assessments, the number of students who have been referred to district-employed school-based mental health services, and the number of students who have received other services. The second part of that is also, and our numbers in this area are going to look very extraordinary, is the number of certified school psychologists we have, licensed psychologists, school social workers, counselors, licensed, and et cetera. So I just wanted you all to see that there will be a report forthcoming for September 30th. And finally, just to bridge, and Mr. Oswald mentioned it earlier, this is just the start of the work. As you all know, the referendum dollars is going to give us the ability to expand upon the amazing work that's been done so far this year, and we're excited about it. Inclusive of, we'll be hiring 40, I think we've already started on the 20, we'll be hiring a total of 40 new school psychologists. School counselors will also be increased. Each middle school, as you are aware, will receive, have the ability to have 3 counselors. Those schools that presently only have 2 counselors will be brought up to 3 counselors. So every middle school will have 3 certified school counselors. And then last year you all approved the job description for the behavioral health professional, where we will be hiring 170 of those. You heard Dr. Shannon talking a little bit about the pilot that I put in place this year to try and see what that could look like, in the hopes that we would have an opportunity to expand it. And we have learned, lessons learned this year have been amazing and will help us as we bridge that into next year. And then, of course, you also approved a director for the Department for Behavioral Health, Mental Health Services. So much of the staff that's here today with me will be moving into that new department. So the Department of Safe Schools will have some shifts, and I will be assisting with those shifts in response to your question earlier. And that's all.
And we'll go ahead and turn it over for discussion.
I've got a couple questions, and I see a lot of hands, but I'm going to go first this time. When I stop in the schools, one of the common concerns I hear from the school counselors is they don't have time to do school counseling. They're covering classes, they're doing lunch duty. So I think the board should have a report from the schools as to how much time the school counselors are actually getting to counsel and how much they're pulled out of counseling to do other things. So, Mr. Superintendent, maybe we can have a periodic report from the administration as to whether our school counselors, these new ones we're hiring, are going to get to actually counsel, or they're going to cover lunch duty. So let's see what we can do on.
Real quick, in response, so again, part of the budget process, we've been discussing this. And so one thing I need the board to hear me loud and clear on, as we move into next year, there will be some very explicit instructions to school-based administrators around counselor ratios, job tasks. It's going to seem a little different for our district because we've allowed so much autonomy. But when we think about these new positions, the statewide grand jury report and our reporting mechanisms around time and et cetera, we've already been through this once as a team for our local grand jury. So we've been very clear that Keith and I are going to have talked and will continue to talk about some very explicit instructions specific to what you're talking about.
Great. Thank you. With respect to the, parents are going to be concerned about telling you that their children have been referred to for mental health. And I heard you say that there's going to be some security on that tab. But we have a lot of parent volunteers in the schools, and in the past there's been information spread by one parent to another. So how much security is there? Is it just up to the principal who's going to be able to grant access to that tab so that people in the school can see that, or is it something that has to be cleared by the regional office? How do we make sure that nobody has access to that confidential, very confidential information that the parents are not going to be happy if it gets out about their child?
So it is cleared by job title, and there's training that goes behind it. And the principals have been told, obviously there's a high level of confidentiality as well as the FERPA laws that exist within this, so that we've been taking that very serious and letting our schools know that.
And is there a way in our system to see who accessed it? So we can see who
Yes.
logged in and saw that?
With SIS, yes.
Okay. And my last question before I get to all the hands down here. Explain to me how a manifestation hearing works. I gave this example before. I'm sure that Nicholas Cruz had plenty manifestations of his illness until he did the last manifestation, which he killed 17 people. So my understanding is if it's a manifestation of an illness, we can't really discipline the child or move him to another school. So explain to me how we differentiate a dangerous child that we have to remove from a child that's doing a manifestation of an illness and he's dangerous, but we can't do anything. So can you just explain how that works?
I can summarize it quickly for you. Manifestation hearings are required for students with disabilities and students with 504 plans if it's being recommended that they're going beyond their 10 days of suspension or that we're considering another educational site based on the behavior that's being addressed. That manifestation determination is based on the event that happened and the IEP team that typically comes in play with additional members. The members that are required are the school psychologists, the teachers, those who know the child best. There are several questions that they go throughout that manifestation determination process, some of which are, was the plan in place? Is the child's plan appropriate? And was that plan in place when this event or the behavior happened? As a result of those questions, the team determines whether it is a manifestation of the child's disability or if it's not a manifestation of the child's disability. If it is not, then the team can proceed with whatever consequences is determined. If it is, then our task is to readdress the plan and address the issues that were identified as they went through those questions to be able to make sure the student's plan is appropriate for them based on the behaviors that they have.
Okay. Okay, thank you. Mrs. Whitfield, then Mrs. Brill, then Mrs. Andrews.
Well, I'll be quick because you asked one of my questions, so good job. I wanted to first of all say thank you so much for all of you taking on this task. This has been huge and such a big deal for the school district. I do think we're leading the way in this, and so to me that's really special, and I want to say thank you. I also want to say thank you to Heather Knust, who's not sitting with you, but I feel like she should be, because she really did explain to me so well how we're spending all this money. So I think that really kind of got down to what we were trying to do, and I'm very excited about that. So the question I have is for Detective Griffin. I told myself I wasn't going to say that over and over. You said collaboration a whole bunch about how we're all going to work together, but I wanted to understand a little bit more about how you can enter the system, who reports, how does it get into the system, and who spreads that word out. How long does that usually take? I just wanted to understand a little bit more about that whole process, and how do you guys talk to each other? Do you have a weekly meeting? And
We meet frequently, but almost weekly, if not weekly, probably at least no longer than every 10 days for sure, but we try it weekly. So the information can come in, like I said, filters in from, you're talking about from the source of the incident to how we receive it and how we share it?
So I'm more interested in if there isn't an incident and you just have suspicions. Like, how does a teacher deal with that? Or if a principal has a concern, what do they do?
Right, so there's several reporting ways that students can report, that teachers can report. And I think June probably receives them more from the school-based side more than I do. I receive them from the police officer, but they're collaborating at the school-based level. So sometimes we'll receive these cases simultaneously. And then she's looking at it from her lens, I'm looking at it from my lens, and we're constantly talking. In addition to the meetings, like I said, we have routinely, in addition to with the meetings that we have with JFK North and those types. So the judge, the school safety with Judge Martz. June, I don't know if you want to speak to this more.
Sure. And actually, the collaboration, we meet, the people that are sitting at the table meet and talk about these students on, probably every 10 days. But the three of us probably talk on a daily basis about any student that we have concerns about, whether it's in any one of our arenas. And as luck would have it, Robin and I actually are in the same school building across the hall from each other, so that for this transition time, it's been very convenient for us to be able to have daily conversations. But it could rise up from a school center calling me and saying, we have concerns about a student, this is what we know, this is what we have, and we might call in the C.A.P.E team, we might call in somebody from the school center, we might call in a school psychologist, depending on what manifests. But then if it needs to be, there's a criminal end of it, we're going to call in the school officer, and we're going to call in Robin's team as well.
So as we grow this team to 200 more people plus, is there going to be more than just a phone call way to connect with each other, a way that we can really do that kind of electronically without exposing all this data?
So we have electronic pieces already in place that have been built for some of the other components like bullying and harassment and Title IX that go through my department, and we're building through the threat assessment teams that we have been working on the training for with the school administrators on online portal as well. So there'll be an ability for them to push it through on a form, and it'll go automatically to certain people's desktops, and then we'll be able to dispatch from there. So there's going to be numerous ways that we can find out this information.
Okay, thank you.
And also Fortify Florida is out there too. So that's a mass ability to notify many people at the same time about the specific threat.
Great, thank
Ms.
you.
Brew.
Thank you. And so I do have a couple of areas of questions, and they're very simple, but I do want to address the manifestation of disabilities for just a minute to say that, if the team decides that it is a manifestation of disability, we know that those children are entitled to a free, appropriate public education, but other students and the teachers are also entitled to a safe environment. So that might mean when that team meets, that student's going to have extra hands in the classroom, perhaps. Maybe it's a paraprofessional. Maybe it's an extra teacher in the classroom where those students are. So again, I'm going to return to that ESC budget and 504. We have to make sure that if there is a child, because if it's a manifestation, doesn't necessarily mean that, yes, the consequences will be different, but we may have to put other things in place that are going to cost money so that the child gets the education that they deserve and that there's a level of comfort for everybody else that's in the classroom. So again, I ask that you make sure that we keep that ESC budget nimble because we may find that we need it. My questions, I appreciate the update for the numbers on page 9, which had to do with the mental health professionals and the referrals. We've had a huge number of referrals. I think that's terrific. And I appreciate the update on the consent for services. Can you tell us how many open cases we have now, and if you have any idea how long it's going to take for those open cases to be addressed?
Was that for me? For Mike?
Dr. King.
So the number of 1,274 reflects students that are currently receiving services, are in the pipeline to receive services, or have completed their counseling services. For that, so that number reflects those three buckets. The difference between the number of referrals and the number of consents, that's that dialogue that's occurring between the co-located mental health professional, the school-based folks, the school counselor, school-based team leader, and the families talking about the services and the families acceptance or declination of those services.
So what is your anticipation of the gap in terms of getting them into the services? Is it going to be a month, several months? Is it a week?
So under this initiative, school students are receiving approximately 10 counseling sessions which may be extended based on needs of that student and as discussed with their clinical supervisor. So the difference between the referrals and consent for services, that number, it has to do with the exchange between the family and the school about signing off on the consent. But our students are actively moving through the processes, and they are being seen, very, very, upon receipt of consent.
And if I may follow up with my other item, Mr. Barbieri addressed the FERPA issue that I was going to bring up in terms of the registration. So my question is, are the parents answering that to the best of your knowledge? I'm sure there's a lot that aren't. And is there a way that we can get a message to the parents that telling them about the confidentiality? Is it on the form stating that it's confidential, that or I know you have to follow up if they say yes. But I think there's this feeling that if they flag their child, it's going to carry through. And, we have FERPA requirements, and I think people are going to be afraid to answer it. So what can we do to lessen that?
Yeah, I think this is our first go-around with this particular piece. We can definitely take those suggestions and look at it as we revise our registration form.
Yeah,
looking at it.
yeah, and we wanted to also educate the parents before school started, but it was only any new registering students. So as this becomes what we are doing for all registration forms, because that will be the case for new and returning, that we'll be able to do some communications out to the parents and making them understand as to why this is now on the form. But the confidentiality is for the entire registration form.
And maybe it's when you do those open houses, but also maybe it warrants a robocall also explaining it. So it's just something to think out of the box a little bit before school starts, because I think it's important that we have to collect that data, but we need to give a safety net to the families so that they understand that this isn't going to be a red flag for them.
Mrs. Andrews?
Thank you, and this is so important, and I love this work, so thank you very much. I happened to be at an alternative site just a few days ago, and I saw the social service facilitator, and all the kids in the school said, yay, they're so happy to have her on site. So that's good stuff, and as you look at what we're doing, it's great. But I have a little situation, and I think I figured the answer out, but I still want you to answer. I was involved just recently with a situation where a child had been sent home, children had been sent home. And sometimes, children are sent home for suspensions, and sometimes there are special situations or whatever. But these children had been sent home, and they had been home for weeks. And so I'm looking at this program that we have here, and I wonder who would it be that would actually, and I guess they were waiting for a placement somewhere, either at an alternative site or whatever, and the parents were just up to their wits' ends as to what to do, having a lot of failure with the school district. So would it have been the behavior service investigator or the C.A.P.E team who would actually go to that house and work with that student while the school district is trying to get it all together? And it may be a situation where it wasn't the fault of the student that they had been sent home because of an unusual circumstance, or it could be a suspension before the paperwork is processed. How will a parent know what to do with all this great work that we have now? Who would be the contact person for a parent to get some help for if the student is sitting home each and every day? I think the Marjory Stoneman Douglas incident where the child was home and went back to school. So I'm looking at some situations like that here in the county, and I'm wondering, as I hear this great information today, what do we do with situations like that? Because they're existing right here in Palm Beach County School District, and I just dealt with one recently. So what would we do?
So first, I want to say that if a student is not home on a suspension, they shouldn't be just home. So we'll definitely address that with the principals. If they're with the principals, if a child needs additional support, to make sure they're aware of all the resources that exist in our district. For a parent, they should first and foremost reach out to their school principal and school administrators on a particular campus. And then obviously they can contact any of the individuals up here at the district level so that we can make sure that we provide that support. And I think a lot is dependent upon what the situation is as far as who would go out and support that family.
Okay.
Dr. Robinson, then Mrs. McQuinn.
Okay, thank you. Of all these positions, who needs to have a billable diagnosis?
Can you repeat the question?
So, some of these people are billing children's insurance, right? Which means that they're going to pathologize them so that they could get paid.
Dr. King, will you take that one as it relates to the co-located therapist?
So when we were developing the co-located mental health professional initiative, we made it very clear that a diagnosis would not be required in order for a student to receive support. So that we set up that yes, there are options to bill Medicaid, and a few of the agencies are taking advantage of that in certain cases, but that no student would be denied services because there was not a diagnosis or the parent did not want to pursue that.
Okay, so I appreciate that. I'm kind of looking at the other side of the coin, right? So I understand that there's this preponderance, especially from certain agencies, to diagnose children with conduct disorder, right? And so what are we doing to monitor how they are labeling children?
So I think they have to provide monthly reports on their work. So I think we're reviewing those reports on a regular basis. And through this model, as we work through it, I know we're revisiting on a regular basis of where we need to put additional eyes on. So I think we can review those reports and see what's in there.
Okay, let me follow up. So, okay, and do we know if any of these agencies have their staff go through training related to trauma and cultural responsiveness?
With the 7 agencies that we're working with, I cannot say that all 7 have, but I am aware of at least 3 of the 7, and that is a part that we have requested, but it's not required inside of the bid because they have the behavioral health. The only agencies that were allowed to be co-located agencies for us were those that were part of our behavioral health agreements. Mm-hmm. So they had to be one of those 31, and some have and some have not.
And so what happened to the concept of the portal and the concept of knowing if they actually help students? Because saying that X number were referred and X number of cases were closed doesn't tell me if they helped the child. And what is the expected outcome of the therapy, right? And so how do we measure success? And that was, Dr. Francois spent a lot of time working on that portal, and at least I personally think it was truly, truly a step in the right direction, and I don't hear anything about it. It sounds like it's been thrown away, and I'm like really, really, really concerned about these well-meaning folks with their advanced degrees walking up to children and saying, oh, poor baby, and let me just diagnose you so I can bill. I'm exaggerating, but I hear stories about the interactions between some of these professionals and children, and the examples that are in my mind reflect no understanding of trauma, reflect no understanding of cultural responsiveness. And so if we're going to be giving people the contracts, and it was a lot of work done walking down this path. If we're going to be giving people these contracts, we need to make sure that they treat our babies right. It's not enough for us to just check the box, and I'm afraid that that's what I might be seeing.
And so that work is still in progress. It has not been set aside. The urgency around what came this past summer, this has all been fast forwarded, but the work that Dr. Francois is working on, she's working with a number of different departments to bring some prototypes forward around that portal. So that's still in the works, so that work will be forthcoming soon.
Mrs. McQuinn.
Much on my mind now, but let me just go to my first thing. I think it was at the last board meeting that I asked if in the interviewing process, I don't know whether we agreed or not, but I think I remember, that the district will create a pool of the school-based professionals, mental behavioral health professionals. I didn't see that here, so I don't know if this is premature, but I want to get it in there anyway because I do want to compliment you on, it's very clear to me in the presentation that you have incorporated the comments and the questions that we've previously had, so I very much appreciate that. And I am very confident that you're going to do the same thing moving forward. How do you know what we think until you hear what we think? So at the last one, I suggested that, because there are some principals out there who believe they have someone qualified on their staff that they can just move into a position. Well, no, they can't. And so, of course, that needs to be communicated, that they will be selected from a screened and interview cleared pool of people. And certainly they would encourage their folks to apply if that's what they want to do. So I asked about organizations, and of course I'm very specific to Families First, since that is the board that I have the privilege of sitting on, and they do have professionals in our schools and have success working with our students, that they be included some way in this screening and or interview process. Now what I would like to ask that we consider is that we canvass our school district employees. For example, there is a principal, I'm sure there are many, who continued to keep her license from the state of Florida as a certified, I don't know, clinical psychologist. I'm not sure what it is. But we probably have, I know I came from social work aspirations to education. So I think we have many qualified already employees who have demonstrated their worth, and of course they know their kids. So I would just like to suggest that somehow our current employees be canvassed in the event that they are qualified and that they're interested in serving on these interview committees. That was a long way of getting to it, but thank you for listening.
Dr. Robinson?
So I too have concerns about the whole screening process and the interview committees. I think that we kind of need to follow the model of when we selected the chief of police, where we had experts in that field weigh in and tell us how to evaluate. I mean, I'm sure that there's like people in the schools who could have said what a police chief looks like, but I think we need to tap outside expertise. And I really think it might be a conflict if somebody has a contract with us to be on the interview for the people who will be recommending renewing the contract. But all that's to say is I really hope that we tap expertise from outside of the school district to help us evaluate who goes into our schools. The people who've been doing this work need to help us do this work.
Dr. Fenoy?
Yeah, so to both Ms. McQuinn and Dr. Robinson, not only are you both correct, the chief of HR has already begun that process. He and his team submitted a request to build an infrastructure. So one of the things that I learned during their budget process, we don't necessarily have a pool process. Like it takes infrastructure to create a pool process. And so we learned today that we don't have one. So that was one of the requests. I think because of the experience we had with selecting the chief of police, it turned out well for multiple reasons. Not only did we get a great chief of police, but it also sent a message to the community that we are partnering with you in this very important effort. And so we already set that groundwork, and absolutely, Dr. LaCava, and not just this position. There are multiple new positions where we will be making sure we have community feedback, participants, as part of the overall committee.
Mrs. McQuinn?
Thanks for reading my face. I so agree with the process that was conducted with our chief of police, but pointing out that there certainly were people involved who are contracted with our school district. So I just have to get that in there. Again, you'll build the structure for it, but I certainly would not want to exclude our current employees.
Okay, I want to return to this new question on our registration. Again, I may be over-exaggerating this in my mind, but I just got a feeling that parents are not going to be willing to answer that question. And I understand, because my wife was one of those secretaries that stood at the front desk and accepted these registration forms. They go into a pile somewhere before they get to the data processor. So I don't think that's going to work. You can't ask a parent to hand that over to the lady at the front desk that has that confidential information on it, and now it's sitting in a pile in the office where everybody that has access to that pile has that. I think that we need to look at giving the parents a way to enter that information on their computers, go into the SIS system or whatever way, and they go in there, and we give them directions on how to do that, telling them that nobody has access to that except certain people, rather than handing that form over. I don't see parents doing it. I just don't see parents labeling their children as being mentally ill in some fashion and handing that over to a lady at the front desk. No disrespect to the ladies who work at the front desk, but I mean, that's public. I mean, it's like sitting there and everybody can see it. And if they're filling it out and checking off, there's people standing around watching. So we need to revisit that before we put that in place to make sure that these parents feel totally secure that when they answer that question, nobody is going to see it except the people that need to see it.
And we'll work with the legal department. Right now, I think the statute's pretty clear that it was supposed to be on the registration form. We'll see, and we'll work with the Department of Education. We have had actually thousands, I think it's been, who have actually marked that as yes, so we were quite surprised at the number of parents who are marking that yes. And again, we'll continue to work on the training in the meantime to ensure that the confidentiality is happening in our schools.
My understanding, the statute just requires at the time of initial registration, they need to answer that question. That doesn't necessarily mean it has to be on the registration form. It just means when they register their child, they have to answer that question. So let's figure out a way to get them to answer the question where they're totally confident. You say thousands have done it, but there may be thousands more that said no because they were afraid of that information getting out.
We'll take a look at that.
All right, thank you. All right, Dr. Fenoy, I guess thank you very much.
Thank you, team. The next workshop, our good friend Kevin McCormick will be discussing, and Mr. Harvey Oaxaca, our ESOL new platforms that are currently in the bid process. So I turn it over to Deputy Superintendent